In New Zealand, there are about 175 practising ophthalmologists. In Papua New Guinea, a country which has twice as many people, there are just 11. The training of specialist eye doctors and nurses is a huge focus for the Fred Hollows Foundation, a charity whose mission is to end avoidable blindness in the Pacific. And with the help of donations and the New Zealand government, a new eye clinic will be built over the next 18 months to help attract and train locals. Here's Laura Tutpo.
The eye clinic at Port Moresby Hospital is where Dr Alice Irafa currently works. She's completed her training. Next year she will graduate as an ophthalmologist. Her specialist training has been supported by the Fred Hollows Foundation, and next year she'll return to her home province to work.
Still an unrealistic feeling to me, probably maybe on, I don't know, when I'm actually practicing, seeing my first patient on my own, then it will finally sink in that, yes, I am an ophthalmologist.
Since 2007, the foundation has supported the specialist training of 130 eye nurses and eye care clinicians and 6 eye doctors in PNG, including these two, performing cataract surgery as part of their training with their mentors by their side. This type of surgery is different from others they've performed in their medical careers. This is microsurgery using precision tools.
It took me a while to get the hang of using these instruments, but then over time you develop the, skills for working with them, and then it becomes more easier.
The clinic in Madang, the north of the country, is well supplied, supported by the foundation.
We have all of our equipments there, all of our staff, we have enough staff, and we have all the consumables that we can work with, so the training here, I'd say, is really good.
Consumables, the medicine and equipment needed to treat patients, aren't always readily available. And with only 11 ophthalmologists for the whole country, there are also workforce challenges.
Our best contribution to the health systems in PNG is to train these ophthalmologists and to train these nurses and to return them back to those provinces and say, here's the capacity you need to design and deliver your own services.
Through partnerships with universities, Fred Hollows Foundation supports the training. And they're now about to build a new clinic at the public hospital in Port Moresby to help.
This facility will serve more people than what we are doing now. I think we can see an increase of 30 or 40%.
This is all part of the master plan of the Port Moresby General Hospital. You can hear the construction behind me here for the Cancer Centre, but this site in particular was chosen because of its close proximity to the medical school, this blue building behind me.
Because the centre will have equipments, instruments and facilities that we didn't have before. This will be a great step in their advanced training of their ophthalmology training. We thank the New Zealand government for supporting us.
The New Zealand government contributed $18.9 million towards it, as well as investment from the Australian government and, of course, donations to the foundation.
Papua New Guinea is likely to need more than 100 ophthalmologists over the next 20, 30 years. We hope the centre is going to be able to contribute to at least building halfway some of that capacity.
This is going to be a big dream come true.
A dream to train Pacific people to fulfil the foundation's mission of ending avoidable blindness in the Pacific.